Well, in our top story this morning, co-payments for medical aid members will be abolished when the proposed Medical Aid Schemes Amendment Act is passed. Health Minister Dr Aaron Motsoaledi says the new bill proposes that medical aids foot the patient's expenses in full. Motsoaledi made the announcement at a media briefing in Pretoria. He says the long-awaited proposed law to introduce national health insurance will be mandatory. Molemo Mothoa reports.
The bill seeks to provide free, high-quality health care for all people, regardless of their employment status. According to World Health Organization, only 10% of the South African population can afford private health care. The minister says this is unacceptable. He disputed the notion that piloting national health insurance has failed, and there'll be drastic changes to medical aid rules. Every cent charged to patients by a doctor or hospital must be fully settled by the scheme.
We are doing away with co-payments, but we are also saying the Council of Medical Scheme need to work very fast to introduce a new policy whereby medical schemes do not have to keep 25% because it's too high in reserves, but release that money for the care of patients.
Motsoaledi says medical schemes are currently holding reserves of 60 billion rand. He says these reserves were partly accumulated through high premiums and co-payments. The bill has been gazetted. It will be open for public comment for 3 months. Molemo Mothoa, SABC News, Pretoria.